Good evening, everyone, and a very warm welcome to our session today. I'm Dr. Anoushka Amlani, and on behalf of Voice of Healthcare, I welcome you all to our third session of National Virtual Roundtable on National Anemia Awareness Day. The theme for this initiative is Anemia Advancing Hematological Health, Navigating Rare Disorders, and National Initiatives. The prime focus for today's discussion is going to be on understanding the significant impact of Anemia Mukt Bharat initiative and National Anemia Awareness Day from the government's lens. We'll also be exploring the diversity of anemia in eastern part of India and the characteristic and advanced diagnostic approaches for anemia. This campaign is an initiative of Voice of Healthcare and supported by Zydus Life Sciences and in the issue of public health awareness. I would now like to introduce our esteemed panelists for today's session. Dr. Prabha, RRC, Northeast, branch of NHSRC, Ministry of Family and Health Affairs, Government of India, Guwahati. Thank you for joining us today, ma'am. Dr. R.K. Jena, Professor and Head, SCB Medical College and Hospital, Cuttack, Orrisa. Welcome, sir. Thank you for joining us today. Dr. Avinash Kumar Singh, Director and HOD, Hemato Oncology, Paris HMRI Hospital, Patna. Welcome, sir. Thank you for joining us today. Dr. Maitreyee Bhattacharya, Professor and Director, Institute of Hematology and Transfusion Medicine. Welcome, ma'am. Thank you for joining us today. Moving forward, I request Dr. Prabha, our keynote speaker today, to kindly make her keynote address.
Good evening to all. First of all, I would like to thank Voice of Healthcare for inviting me. And I would also like to congratulate you on organizing this National Virtual Roundtable on National Anemia Awareness Day today. And first of all, I'm a public health specialist, so I'm not a hematologist, and I would not know the depths of, the main hemoglobinopathies and all. So I will just give my government experience and what we know about the programs that we are doing through NHM, through, the national health programs. So as we all know, this anemia has been a very has been a very long-term deficiency disorder in our country for a very long time, and we have had many national health programs right from almost 30-40 years ago. But as of now, as of today also, we have a lot of this deficiency happening, and as of the between this NFHS 4 and NFHS 5 data that we know of, the prevalence of anemia has in fact increased a little bit more in women of reproductive age group, as well as amongst the pregnant and in non-pregnant women. So this is a cause of concern. However, with this, the Government of India initiative on Anemia Mukt Bharat, we are trying to decrease this anemia amongst many groups of, as a life cycle approach, like below 5 years of age. Then we have the adolescent girls and boys. Then we have the women in the reproductive age group, then non-pregnant, pregnant women. And also we have this, national deworming days happening. Then we have a separate program for sickle cell diseases amongst the tribal population. So these are some of the programs that Government of India, through the National Health Program initiative, is trying to deal with the anemia that is happening amongst the population today. So I would like to talk about the primary care level. as we all know, we have a three-tier system of subcenter, then we have the PHC, secondary level district hospitals, and then the tertiary care level hospitals and the medical colleges. So at the subcenter level, as of the 2017, this national health policy, that the government of India is trying to have a better comprehensive primary health care, and by converting this around 101 lakh 60,000 sub-centers into health and wellness centers, and as of now we have this Ayushman Arogya Mandirs. And in this, we have the expansion of services, and Anemia Mukt Bharat is one of the main programs that is being undertaken by the healthcare providers. And then we also have this WIFS program, in which the school children are given weekly iron and folic acid tablets. And also we have this through not only by providing iron, but also by giving IEC. There is awareness about anemia. There is awareness given through this Ayushman Bharat ambassadors, who are actually teachers in schools, and they give a weekly IEC to the students. And we also have this in this program. We also have the students who are Ayushman Bharat, Ayushman ambassadors, and Ayushman messengers, who act as peers for their other classmates. So these are some of the things that the government of India is doing. And then also through the food fortification system, through the FDSI and all, the food fortification is also going on, because until and unless our food is fortified, we cannot have only, either taking tablets or either deworming. So these are some of the initiatives that I would like to share with the esteemed panelists today. And I think with these few words, I would like to end my talk. And as I'm in a very big hurry, so I will wait for some 10-15 minutes, and then I would like to leave. Thank you so much for having me here. Thank you.
Thank you so much, ma'am, for taking out your valuable time and making all the adjustments in your schedule for us. We, from VOH, we are extremely grateful for your time and for your lovely insight on Anemia Mukt Bharat. Thank you so much.
Thank you.
Moving forward, I would like to ask a question to Dr. R.K. Jena. So, can you please shed light on the different types of anemia and their prevalence in East India? And what is the role of hematologists in Anemia Mukt Bharat?
Okay, thank you, Dr. Anoushka. So far Eastern India concerned, the commonest cause for anemia is obviously iron deficiency anemia. As the prevalence of the anemia in Eastern India, the general population is more than 50% of the Eastern India populations, they are anemia. And as Madam has already told, that if you compare the data of the fourth National Family Health Survey and fifth National Family Health Survey, which came out by the Government of India the last December, instead of decreasing, it has increased by 14%. That's the paradox. In spite of our best effort taken by the Government of India, various state governments, the incidence has increased rather than to decrease. It has increased by 14%. So as on today, the incidence of anemia in Eastern India stands around more than 50%. The commonest cause of anemia is iron deficiency anemia, and secondly, folic acid deficiency. Third important factor, which is always mixed by the policymaker or planners, is vitamin B12 deficiency. Considering or the type of the diet or the whatever we take our dietic habit and practice, vitamin B12 deficiency is as common, even more common than the iron deficiency anemia. It can be go up to even 60% also. So unless and until you correct the vitamin B12 deficiency also, anemia is not going to improve. And another major cause is your hemoglobinopathy. It's very, very common in Eastern India. A type of the hemoglobinopathy is sickle cell disease, thalassemia, hemoglobin E disease. So for Odisha state is concerned, now the data are available and mature that roughly even 18% of the total Orissa population, they carry abnormal hemoglobin gene either in the form of sickle, beta thalassemia or hemoglobin E disease. So these are the common causes of the iron deficiency, anemia, folic acid, B12 deficiency, various hemoglobinopathy together taken together. They constitute the common cause of anemia, which can be prevalent in almost more than 50% of general populations. And importantly, the WHO has estimated that if the anemia will be corrected, our national productivity can be improved by 20%. It can reduce also the maternal mortality, infant mortality to a great extent. So this is the important relevance of anemia in Eastern India. The role of the second answering or second part of your question, that
I think there are some technical issues from Dr. R.K. Jena's side. We would like to move forward, and I would like to ask my second question to Dr. Avinash Kumar Singh. Sir, what is a schematic procedure for patients and diagnostic tests to differentiate between nutrition deficient anemia and rare disorders?
Okay. Thank you, Dr. Anoushka, for inviting me, and thanks to VOH, Voice of Healthcare, for organizing this important meeting on rare hematological disorder, which is very important to discuss not only for Eastern India but for whole country. And as far as rare disease is concerned, so unfortunately we don't have clear definition how to define rare disease globally. It's not in India, it's not defined, it's not everywhere. We don't have good definition to define, or we don't know what diseases are included in rare diseases. But if we see the WHO definition, they say that the incidence is less than 1 into 1000 population, then they define it as rare disease. So as far as your question is concerned, so the nutritional deficiency and rare hematological disorders. So how to differentiate? That is the question. So since both nutritional deficiency anemia as well as rare disease presenting with anemia, they will have anemia as one of the presentation. But the differentiating points are, first is the rare hematological disorder patients, they will not show response to hematinics. That is, they will not show response to iron supplementation, vitamin B12 supplementation, or folic acid supplementation given to them for a certain period. So that is one clue where one should suspect that it's not nutritional deficiency anemia. It could be something else like a plastic anemia or thalassemia or some other disorders. First is that. Second, there are some specific symptoms with which rare hematological disorder patients can present, like fever, lymphadenopathy, organomegaly, jaundice. And third is maybe they are requiring frequently blood transfusion, which is not seen in nutritional deficiency anemia. So these are the symptoms. Depending upon that, we can differentiate. Coming to investigation, so for any type of anemia, the first investigation that one should do is CBC, that is complete blood count, which is available everywhere in our country, in all districts of our country. So first test that one should do is complete blood count. So CBC tells us that whether it is only anemia, whether it is anemia, it is microcytic hypochromic anemia or macrocytic anemia or normocytic anemia. Then it will tell you that whether the platelets they are normal or not, if there is WBC is high or low or normal. So they can some guide us that whether it is nutritional deficiency anemia or some rare hematological disorder like aplastic anemia or thalassemia or something like that, or leukemia, lymphoma, multiple myeloma. So CBC is first investigation that one should do. Then second is peripheral blood smear and reticulocyte count. And a good peripheral blood smear examination is very important. So it can gives us thousands of information that what could be the cause of anemia, whether it is nutritional deficiency anemia or rare hematological disorders. So depending upon the CBC, peripheral blood smear and reticulocyte examination, then we move forward And if we suspect that it could be a rare hematological disorder, we may have to do bone marrow examination or some specific test like hemoglobin electrophoresis or HbHPLC, or sometimes osmotic fragility test to detect some rare hemolytic anemias. So this is the way we should move forward. We should try to differentiate nutritional deficiency anemia from rare hematological disorders.
Thank you so much, sir, for your input. Moving forward, I would like to ask Dr. Maitreyee our next question.
Hello.
Ma'am, having been the first to start a bone marrow transplant in the state, how has the landscape of awareness, diagnosis, and patient acceptance for rare blood disorders treatments changed in your experience?
Uh, if you ask me, there is some awareness now compared to the past. Rare blood disorder also is not a single disorder; it's a group of disorder. Many disorders are there. So out of these few disorders now, physicians, they are aware of that, chronic myeloid leukemia, chronic lymphocytic leukemia. So looking at the report, at least they can suspect that this is a blood disorder, send the patient to the uh, nearest hematologist or hematology center. But there are rare blood disorders where, like PNH, like Castleman disease, these are histiocytosis, these are the disorders where till now that much
Yes, sir.
awareness is not there, and
Hello.
most of the time. Yes, Dr. Jena. Hello, Dr.
So we'll
Jena.
come back. So we'll come back to your question as well.
So most of the time, like, it's missed,
Dr.
as
Anoushka,
a,
is it audible?
yeah,
Yes,
Dr.
Yes,
sir,
Jena,
you're
you
audible.
are
audible.
audible.
Yes, you're audible. We'll come back to your question. Right now Dr. Maitreyee is answering.
So as a result, it takes long time for diagnosis of this sort of rare blood disorders, and this is really a problem till now. And treatment also, it's available only to the very special centers. Very few doctors are trained for treating this sort of disorders, and awareness and acceptability of the patients also is acceptability basically depends on the physician or the hematologist who is treating. Like, if you can explain it to the patient properly, they will accept the disease and they will come for the treatment, and they will be, in most of the cases, you can make them either in remission, or they can have at least a fruitful life, a quality of life. But till now, what I think is that rare blood disease, like hepatitis, rare blood disease, like common blood disorders, also the awareness till now is very much lacking. And as a hematologist, I think that hematology is a new subject in India. So this type of awareness, we should give more importance to this side of awareness, to make people, to physician, pediatricians aware about this, about the common signs, symptoms about this type of diseases. That, I think, will make the patients diagnosed earlier, and they will also get benefited from this type of thing. And I think the government initiative should be there to have this type of program at the district level, so that we can sensitize the physician, pediatrician, even the lab people for this type of disorders.
Thank you so much, ma'am, for your insight. My next question is to Dr. Prabha. Ma'am, how can Digital Bharat Mission help with anemia initiatives in general and in rural areas, especially in the eastern part of India?
Can you please repeat the question?
Ma'am, how can Digital Bharat Mission help with anemia initiatives in general and in rural areas in the eastern part of India?
Actually, the Ayushman Bharat Digital Health Mission, it has started, but it has not completely covered all the beneficiaries as of now. We are still, working on the generation of ID cards, ABHA ID cards, and also of not only the health facility registration, but also the health professional registration is also going on. And in on eastern India, the problem, eastern, or you can say northeast of India, the problem is with the internet connectivity. However, as we are having this, the teleconsultation under eSanjeevani application is going on quite well in many places. And even in the remote area where we can have the internet connectivity, we are able to, through the mid-level health providers. This is the new group of HR who have been posted in the Ayushman Arogya Mandirs. They have undergone 6 months of training in community health. So they have been provided with tablets also, and in some health facilities, they have been provided with laptops. So through these digital interventions, they have been able to have teleconsultation with the specialists in the district or in the medical colleges. And diseases like anemia and even hypertension or other diabetes and all, we are trying to have this specialist intervention at the subcenter level through telecommunication, through teleconsultations. So actually, in the long run, once we can have all the hardware there, once we can train all the HR to use these applications, and when we have very good internet connectivity, I think it will really help in anemia problem.
Thank you so much, ma'am. Thank you for your valuable time and insight. Thank you. Moving forward, I would like to request Dr. Jena to complete his answer regarding the role of hematologist in Anemia Mukt Bharat.
Okay, I'm sorry, probably there was some internet connection problem because I am out of the station. I always told that the hematologist should be an integral part to the core committee of the planning of the national program. The reason I have told you, even if the government of India, various state governments are taking the programs, national programs to combat anemia, the incidence is not decreasing, rather it has increased by 14% in between fourth and fifth survey. So there is some mistake, some wrong somewhere. It needs an involvement of the expert. And still then the hematologist has not been an integral part. I strongly feel that the qualified hematologist should be an integral part of the designing and planning and executing the national or the state programs to combat anemia. This is the most important. The second important aspect is good clinical practice. Hematologists should educate intermittently to not only physicians, pediatricians, obstetricians, even the general practitioners and the public and the NGOs. What are the various causes? What are the good clinical practice? How to treat in a very optimal way? Because we have seen that there are many regions of non-optimal or suboptimal management of the anemia, which is the main cause of recurrence of the anemia and such an high incidence of anemia. So frequent continued medical education program and good clinical practice is another important point that hematologists should take up this issue. Third is, it has been told or it has been well appreciated that iron deficiency anemia is a vicious cycle. As for example, if any lady in the pregnancy is iron deficient, she will deliver a baby with iron depleted stored. And that baby, once she grows up, and once she has attained adolescent, because of the diet, typical Indian diet, the diet cannot give rise to adequate iron which is required. Then because of the menstruation during the adolescent, iron deficiency is aggravated. And that iron depleted young girl, if she marries, again there will be further iron deficiency during the pregnancy. And again the multipad or magnified iron deficiency in the lady or in the pregnancy will lead to another baby which is much more iron depleted. In this way, the vicious cycle of iron deficiency continues. So we have to break this vicious chain to most important, maybe at pregnancy level or maybe at adolescent level in the school going girls before marriage, we have to break that vicious cycle. Third point is that we have given our Society of Indian Society of Hematology has given a concept of an ideal preconception checkup. Means before pregnancy, every lady should have a hematological checkup to know the iron status and the hemoglobinopathy. If there is iron deficiency in not only in anemia but also iron storage deficiency. It should be corrected before pregnancy. If there is any hemoglobinopathy like sickle cell, thalassemia, other hemoglobinopathy, it should be treated accordingly. So that's the very, very important. And I'll be end by saying that our Indian College of Hematology, which is an academic part of Indian Society of Hematology, has almost made an important national guideline on anemia, which has been already endorsed by Association Physicians of India, the Obstetrician Gamma Association, and ICMR, which contains the important information for all stakeholders, starting from policymaker, regulatory bodies, physicians, even patients also. It contains every aspect to control the anemia, to manage optimal way, how it should be ideally controlled, and what is the possible drawback of our national program by which the anemia prevalence is not coming down in spite of best effect, which is going to be released in Delhi during the May. I'm sure this will be a great help to our country. With these words, I again thank our organizer for giving me this opportunity to say a few words on this important subject of anemia, which is the commonest medical problem our country is facing, and it's contributing significantly to our infant mortality and maternal mortality. And WHO estimate if iron deficiency can be corrected, our national productivity can be improved by 20%, and our infant mortality and maternal mortality can be reduced to a great extent. Thank you very much. Over to Dr. Anoushka.
Thank you so much, sir, for your valuable insight. Moving forward, my next question is to Dr. Avinash. So, what is the level of awareness and acceptance for hematopoietic stem cell and bone marrow transplantation, which is a life saving treatment for such rare disorders that we've already spoken about?
Yes, thank you. Thanks for your question. So, before I answer this question, I just want to say that anemia is a sign, it's not a disease. So, it should not be described as hypertension or diabetes. Hypertension, diabetes, they are disease. Anemia is a sign, it's not disease. There are thousands of diseases which can lead to anemia. The commonest one is iron deficiency anemia, or it is because of low iron. So, if we have prejudiced mind, it's important for everyone, common people, doctors, administrator, government officials. So, if we think that anemia is iron deficiency anemia, we will miss all rare hematological disorders. And there are many serious rare hematological disorders whose patients they will die on iron B12 folate supplementation if we don't correct it with proper diagnosis. So, it's very important. Anemia is a sign, it's not a disease, so we have to know the cause of anemia, first thing. Second, your question regarding awareness. So there is a huge lack of awareness about hematopoietic cell transplant or bone marrow transplant among public, and not only among public, even among doctors, even among physicians, pediatricians, pathologists. They don't know about bone marrow transplant or hematopoietic cell transplant, when it is indicated, how useful it is, how life-saving procedure it is. So it's important for all of us, and I think this type of webinar that we are doing with help of Voice of Healthcare, this will certainly improve the level of awareness. So there is huge lack of awareness among doctors as well as public. And what I have found that if patients they are educated and motivated, they have a high acceptance of hematopoietic cell transplant as one of the life-saving procedure compared with uneducated or unmotivated patients or families. The major hindrance to bone marrow transplant or hematopoietic cell transplant is cost and lack of awareness. So I would request government of India also to encourage bone marrow transplant facility at several places, and they should, all the state and central government, they should help patients with more and more financial help so that they can undergo this life-saving procedure, because most of the patients they are very poor. The family, they are daily wage earner, they are earning 100 rupees or 50 rupees per day. You can't think of doing bone marrow transplant which costs around 5 to 10 lakhs or 15 lakhs. So that is all about. Thank you.
Thank you so much, sir. My next question is to Dr. Maitreyee. Ma'am, what are your recommendations to enhance patient awareness regarding anemia in Eastern India?
Uh, this is very much lacking, not only in Eastern India, I would say all over India it's lacking. And like Anemia Mukt Bharat, what program is running on, I have not seen any hoarding anywhere in the city in West Bengal that this program is going on. So this site of hoarding, you remember, like for HIV, so many Guladi hoarding was there. So people became aware from this. So I think this type of hoarding should be there in the cities and in the rural areas also. In the hospitals, like in for primary health center or sub center, like in the walls you have seen, like for family planning, I have seen in my childhood it is to write there that you should have two children only, and with picture and everything. So that sort of thing should be there, like your hemoglobin should be normal, you should give importance on this visualized thing with a picture that should be there in every hospital. At least one OPD wall can be utilized for that. This is very easy way to make people learn it. Then third is the use of public mass medias. We are not using mass medias for awareness program, whether it's thalassemia or whether it's anemia. Thalassemia also is like if you want to control anemia, thalassemia also should be controlled. So everything that should be in mass media, should we should emphasize that whenever, like before the prime time, before the news or before any, even people are very fond of rural people, they are very fond of various type of serials and everything. So in between a subtitle also can run, like before marriage test your thalassemia status, before marriage test your hemoglobin and iron status. So this sort of thing we should do. So this will go to the public, this general population, and in their language we can utilize these medias. Lastly, what I think that, like in the textbook, like we can have very short thing regarding anemia in the, like from 6 7 standards, even or in 9 10, students are intelligent enough to understand, like we can write that this is anemia, your hemoglobin should be this, you should take this type of food to prevent anemia, or know what are the symptoms or what are the causes. If you are having a heavy menstrual bleed or a bleeding during your defecation, you should consult your doctor. This type of very important thing. And also what is going on, it's already there, like hand washing, deworming. But I think it's till now it's people are not that aware. Another thing, what I did many studies on anemia. What I found that in patients who are getting iron folic acid supplementation, the hemoglobin is normal, but they are deficient in ferritin. So iron is not sufficient. With this status, a girl enters a pregnancy. So the whatever iron she had, that is utilized, and it's not enough for the baby also. So what I think that, and many of the students, and even pregnant mother, they actually throw away the iron folic acid tablet. They have been given these to swallow this, to take this, but they don't take this. So either it should be a dot, so that under supervision they should take it, or they should be counseled, they should, so that they should be made aware, so that they will take this. I think this type of activities are very much required, because we are running this program for years and years. Even after these, 50 to 60% of the population, especially female populations, are having iron deficiency. Another thing is that 3 to 6 years of age, iron deficiency is very common in pediatric population. So the parents should be aware about this. What should be the weaning food? What should, like this may be normal thing, but they don't know. So this type of very small thing regarding diet, regarding like habits, this should be the people should be made aware of this, and we should give more emphasis on this health awareness and awareness on anemia. I think then we will be able to be successful to eradicate anemia and anemia Bharat.
Thank you so much, ma'am. That was a lot of important information for all our viewers. Thank you so much. My next question is to Dr. Raj Prabha. Ma'am, am I audible?
Yes, you are audible.
Thank you so much, ma'am. Ma'am, I would like to request you that before you leave, what would be your message for our viewers that in regard to public health and anemia?
Actually, I was supposed to leave earlier, but I found the conversation of all the doctors panelists here very interesting. So I thought I will just stay a little bit longer, and just to say a few things what Dr. Jena had said to involve hematologists and all. So we are part of NHSRC, and whenever there is a for when the national guidelines are going to be made, this time I'm going to put the word in that we should bring also hematologists and all. So I think that is a very important point. But for all purpose, like when we make the national guidelines or anything, of course specialists are involved at the national level. But for these rare diseases like this thalassemia or hemoglobinopathies and all, as of now I'm not really sure whether involvement has been there. And another thing about Dr. Avinash was saying, sorry for my mistake regarding anemia and mixing hypertension and all. I didn't mean that, like, really saying that anemia is a disease as such, but I was just meaning, like, through teleconsultation, we can always, reach out to the patients of anemia also. And regarding what Dr. Bhattacharya was saying about IEC, I really agree with you. We have been really, less on IEC awareness programs and all this. But the major thing is the funding. What the government of India through the National Health Program, we are trying to reach to the states is through NHM. The NHM budget is usually, it is not very high, especially for smaller states in the northeast of India. So that amount of money which the funding is given from the central to the state is money, whatever amount is there, it usually goes to major programs. So programs like anemia and giving iron tablets and all, sometimes maybe a little less, but still with today's the panelists, whatever I have heard, I think a lot of input I am also very happy to hear. And whatever we can through RRC or through NHSRC, through we will try to bring about few policy changes and all from my side, but I cannot promise. But whenever I get a chance, I will of course talk about it. Thank you so much. And to the viewers, what I would like to say is, I think most important is our dietary habits also, from a public health perspective, because nowadays basically, as everyone has also stated regarding iron deficiency anemia, the food that is taken by students or by young adolescents and all, going for things like more of a junk food, that culture, I think we should make them aware that we have to take more nutritious, more healthy food. And we should not forget about our traditional food habits, nutritional, which was nutritional in earlier days. So I think that is most important, apart from the other supplementation. And thank you so much, Doctor, for having me here. And thank you to all the panelists too. Thank you so much.
Thank you.
Thank you so much, ma'am, for your valuable time. We really appreciate all your recommendations for our viewers. Thank you so much. Moving forward, my next question is to Dr. R.K. Jena. So, can you please elaborate on autoimmune hemolytic anemia and a stepwise approach to diagnose and treat it?
Okay, good evening. Is that Rupa ma'am is there, still there? Hello?
Yes, sir.
Yeah, is that ma'am is there? That from NHRC Guwahati?
I'm
Because
sorry,
I
sir.
want to tell her something. Or has
Dr.
she left?
Dr. Rajprabha had to leave early, so she just
No.
left.
Oh, sorry, sir. Because I would have tell to my few important things how a wrong planning has been done without the involvement hematologist. I would have give 3-4 examples how a lot of money, logistics, manpower are wasted because you have a 3 different programs which can be integrated to one also. Anyway, since Madam has left, I will answer your question. Probably this is my last question because I have to catch up something else. You have asked me autoimmune hemolytic anemia is one of the cause, one of the type of hemolytic anemia. It is here there is the your immune systems is hyperactive. so that the RB there is a antibody production against the RBC. So the RBC are eliminated or destroyed from the body. Usually there is a limited destruction of RBC, and similarly a limited production of the RBC. So a balance is maintained. The hemoglobin is maintained around 12 to 13 gram percent. For any reason, if the immune system is hyperactive for various reasons, infections, lymphoproliferative disorders, and other conditions, or viral infections, etc., there is a immune hyperactivity, so the red blood cells are destroyed more and more, so the anemia occurs. That's the reason for autoimmune hemolytic anemia, which can be two times warm antibody and cold antibody, depending on at what temperature this antibody acts or causes hemolysis. The causes can be various, different, etc. But here the most clinical relevance from the public health point of view that all anemia are not same. As for example, if there is a autoimmune hemolytic anemia, if you are going to give a blood transfusion, it will aggravate the hemolysis, and the hemoglobin level will come down below the pre-transfusion level. As for example, suppose you have a hemoglobin level 5. This is a case of autoimmune hemolytic anemia. You have missed the diagnosis. If you give the blood transfusion, the hemoglobin will fall below 5 also. So that's the detrimental effect. That's the importance of knowing the cause of that. Here, the immune suppression has to be done either with your steroids or your prednisolons if there is a warm antibody. If it's a cold antibody, you can go for a combination of cyclophosphamide, combination of the bendamustine or rituximab or cyclophosphamide, because the steroids may be ineffective. And in case of emergency, if you require blood transfusion, you have to look the allo antibody productions or the antigen profile. Accordingly, you have to select the red cell which are devoid of that antigen or over the red cell on the corresponding antibody which are present in the patient serum. So you should go for a best matching or Coombs cross matching. So here the most important public health importance is that if there is a anemia, all anemia are not same. You must be able to know the cause and type or the type of the anemia. Accordingly, you have to choose your therapy, and blood transfusion may not be effective in all type of cases, particularly in autoimmune hemolytic anemia, where transfusion should be avoided. If it is required as a life-saving process, it must be done with extreme cautions by knowing the antigen profile and selected the red cell devoid of that antigen which are present in the patient serum of that antibody. And we should take the help of the blood bank people to select the best cross match or the best match blood in that scenario. For all practical purposes, transfusion should be avoided in case of autoimmune hemolytic anemia. Over to Dr. Anoushka.
Thank you so much, sir, for your knowledgeable insight. I request you to kindly give your message for Dr. Raj Prabha. I'm sure she's going to be watching it and will take a note of what you want to recommend.
Okay. 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 Thank you. I'll do that.
Okay, sir. My next question is to Dr. Avinash. Sir, what are some positive trends about anemia awareness that you witnessed in your experience in your clinical journey so far?
Yes, so in last 10 years of my practice, I have seen that people have become more aware, and not only common people, but the doctors, physicians, pediatricians, pathologists, they have more awareness about different types of anemia, the rare hematological disorders. Because when you start practicing as a hematologist in a area where hematologists were not there, you start diagnosing some diseases, or your approach becomes more scientific. You start dividing causes of anemia, and then when you treat, there is a response. So being a hematologist, I have seen that things have improved in my area, in a stately, mainly in the states of Bihar. And also the digital media, the social media, where when you put some this one YouTube video on different types of anemia, how to treat, how to identify signs of anemia, symptoms of anemia, or different rare hematological disorders. So people listen them, and then they become more aware. So uh, this is my experience. So things have changed, things have improved. Yes.
Thank you so much, sir, for your insight. Dr. Maitreyee, I would request you to answer this question as well. Like, what are some positive trends about anemia awareness that you've seen so far, especially for treatments for rare disorders?
Can you repeat it? What is the important?
What are some positive trends that you have witnessed in your clinical experience so far regarding anemia awareness?
Uh, okay, like everything is not negative. There is a brighter side also, that I agree. Like first of all, like previously, what people used to think that my hemoglobin, doctor, my hemoglobin remains 8, so they take it that their hemoglobin is 8 and that is normal. So that has been changed. If it's 8, if it's low, they are coming to doctor that why my hemoglobin is low. So to some extent they are aware about their hemoglobin level. This is a positive thing. Second, regarding thalassemia, which is giving rise to anemia in India. Now, previously, whenever patient used to come to me, they used to ask me, doctor, is it cancer? But now they are asking me, doctor, is it thalassemia? So they know that something is there, which is thalassemia, and which causes lowering of hemoglobin. So this sort of awareness has come in case of anemia. And another thing which now is a positive thing is that, like previously people used to think if they are a thalassemia carrier, iron cannot be given, but people now know anemia. Thalassemia carrier patient with 5 hemoglobin moving around without taking iron is iron deficiency, but they are not taking. So that wrong belief is not there now. They are taking this. So this sort of thing, they are taking care of their diet to some extent. Like now, I won't say it's fully gone, but to some extent, they are taking care of their diet. They are doing this. Multiple pregnancies, as we all know, that number has come down, and spacing also has increased, so that the consecutive 2 pregnancies are not close together. This is a positive thing which is causing a improvement in the hemoglobin level, and people are becoming aware regarding that. And regarding transfusion, like previously, they have a very they were very much afraid of getting transfusion. Even if it's required, they will try to avoid it. Now that is also not there. So this is a positive thing, that whenever it's required, they will take the transfusion. And this is one generation who are now parents, and regarding their kids, they are taking care from the very beginning. Like they are bringing their children whenever they found that their child is not so active, they are not doing, they are looking pale only. Then also, without knowing the hemoglobin, they are coming to a hematologist. So this sort of thing, and practicing habit also. Now people know that what are the food that contains iron, what are the food that contains vitamin. This is amongst the general population. So that is good. They ask me, doctor, should I take this because I'm having iron deficiency. So these are the positive thing people now has become aware about. Regarding thalassemia, at least lot of awareness change is there, and there lot of awareness. People are coming spontaneously to test themselves whether they are a carrier or not before getting married. So these are the thing we have all achieved, and this will help us to make India, this is anemia mukt Bharat. But I think we need to go far away to for the total control of anemia, and much more important. Still now we need to give for awareness.
Thank you so much, ma'am, for showing us the positive side of the awareness campaigns. Now, before
Can
we
I add,
conclude our,
Dr. Anushka?
yes, sir.
Yes, sir. Sorry to interrupt. So
No,
I
sir,
think
please go ahead.
yes. So COVID has taught us very important lesson. So overall, what I felt that after COVID, people have become more health conscious. So many people, they are coming forward for their health checkup. They are changing their lifestyle, and many times I see that during health checkup, we found that hemoglobin is low, and they come for consultation that my hemoglobin is low. So after COVID, the things there are so many positive trends, not only in hematological disorders, but overall people have become more health conscious, and that has helped. As a hematologist too, we are seeing the positive trends following this one COVID.
Thank you so much, sir. Now that we are at the end of our session, before we conclude our today's panel discussion, I request our panelists to share their concluding remarks and a message for all our viewers. Dr. R.K. Jena, you may go first.
Actually, the most important message I will share that, as Dr. Avinash told, post-COVID, the health consciousness has not only increased, the health budget also has increased. Everybody is now become conscious about health. Number one. Number two, anemia is the commonest, the most important morbidity or the disease that the India is facing. In spite of our best effort for last 10 years, so many national programs, state programs, we are not able to control. So there is some wrong somewhere. It has to be identified. Hematology should be an integral part of the planning and designing and executing that national program. This is my second. Third is there are many programs which are interrelated, but we have a separate programs. As for example, you have an anemia program, you have a thalassemia program, you have a sickle cell program, where they are all interrelated. So the India is a vast country. If you have 140 crores populations of interrelated program with different program, it needs huge logistics. It makes a sense if it's been integrated with the minimum logistic and optimal, you can achieve the optimal result. And fourth is, like the way the COVID got the mileage or advertisement, even HIV got the IEC and the awareness program. Similarly, anemia and this hemoglobinopathy should be integrated, should get the public awareness the way the COVID has got it, and a comprehensive coherent involving so many all the stakeholders in a technical way, in a professional way, should be approached. It's a long run. Then only probably will able to combat that problem, which is going to enhance our national productivity by more than 20% and reduce our infant mortality, maternal mortality to a great extent. That's my message for this.
Thank you so much, sir. Dr. Avinash, I think there's some issue connecting with Dr. Avinash. Dr. Maitreyee, would you like to go ahead and share your message with the
Yeah,
viewers?
yeah. My first thing is that, like what Dr. Jena said, but I would emphasize that we are having a program for anemia control for long time, but it's not becoming effective. So we'll need to find out the pitfalls and modify this. And this is very urgent for a country like India. Like only we are having this program will not help us. We'll have to identify why we are not able to control anemia. What are the pitfalls? This is very important. Second is awareness generation. That is important. Another thing, because government or health officials alone will not be able to control anemia or thalassemia. You need to active participation of the people of the country. So for that we need more and more awareness, that is to be given more emphasis. Third is the general health, the habits like food habits and all these things, the common thing that should be given more importance. Fourth is that we should utilize in country like India, we have many things that can improve hemoglobin level, that we should utilize. What we are not utilizing, like small thing that may not be a drug that are available in India, so we can because that is more acceptable also. First is that cost, what you are discussing, that will reduce the cost, that is more acceptable to the people also. If you ask people to take iron tablet, they will not take. But if you ask people that you take this dal or this sabji, they will take. So I think more emphasis should be given in the change of food habit or general habit of the people. So these are the key things what I want to say for control of anemia in India.
Thank you so much, ma'am. Thank you. Dr. Avinash,
Yes, so know the cause of low hemoglobin, and whatever is the cause, correct it. Never accept 7 or 8 or 9 gram per deciliter as normal hemoglobin. Healthy lifestyle, hygiene, deworming, cleanliness, they are very important to prevent anemia. And if the cause of anemia is rare hematological disorder, always consult a good hematologist and follow their advice. For all people who are healthy, 18 to 65-year age, I would request all of them to donate blood. Raktdan is Mahadan. We have lots of patients of hematological disorder who need blood transfusion and they are dying because of there is no blood in the blood bank. So I would request all people to come forward. I every 3 months donate blood. There is no problem. There is no side effect, so everyone should come forward and donate blood. We can save many patients. Thank you.
Thank you so much, sir. I once again, on behalf of the entire team of Voice of Healthcare, thank all our panelists today for such an engaging session. It was amazing how all of you discussed your experiences and could share so much of value information with all of us. I would also take this opportunity to thank our viewers for staying tuned for our session today. I request them to join our session tomorrow, which is going to be from 2:30 p.m. 3:30 p.m. IST. We now end this session. Have an amazing rest of your day. Thank you.
Thank you. Good
Thank you.
night.
Thank you. Thank you, Dr. Anoushka, and thank you, UH. Thank you,
Thank you, sir.
Thank you,
everyone.
Dr. Anoushka. Thank you.
Thank you. Thank you.
Bye.